Thank you, Honorable Speaker. And I will start at foremost by congratulating my colleague, Honorable Njeri Maina. And Honorable Speaker, also congratulating the House on a priority on private members' bills so that members can be able to impact their life in this House, Honorable Speaker. Honorable Speaker, I rise also to support the bill, and I believe this bill aligns very well with the spirit of our Constitution under Article 43, Honorable Speaker, subsection 3, on issues to do with social security. Honorable Speaker, health is a very critical issue, Honorable Speaker, in this nation. And Honorable Speaker, many of the honorable members who are here today will agree with me that everybody has a case in his constituency or in his county on a detained body, Honorable Speaker. And mostly it is happening in our public hospitals. Honorable Speaker, last week I was dealing with a case in my constituency of a body that has stayed in hospital for 4 months. And the family has taken trips to a hospital in Kikuyu, Honorable Speaker, close to 20 times, requesting for waivers. We write letters, Honorable Speaker, but the family had stopped the mourning. People had contributed all they can contribute, but because the bill is big, Honorable Speaker, the body continue being detained. And Honorable Speaker, this bill speaks to the humanity of this House. This bill, Honorable Speaker, speaks to the conscience of our nation, Kenya. That, Honorable Speaker, when somebody loses a loved one, what remains of that person is to get closure and continue with their lives. Detaining a body, Honorable Speaker, is the worst type of torture for a family that has lost a loved one. Honorable Speaker, I would not wish any person in this nation to experience somebody who has lost their lives and they have been detained. And Honorable Speaker, to prove that, we have seen even those that die outside the country do harambes, even when they are unable to raise the funds to have the bodies of their loved one brought back to the nation, to our nation for burial, Honorable Speaker. And this speaks to our culture. This speaks, Honorable Speaker, to our religion. Honorable Speaker, our Muslim brothers have in their religion that they're supposed to bury their loved ones within a day. And we have seen it many times, including honorable members. When a family is unable to bury their loved one because the body has been detained, it means that, Honorable Speaker, even they feel lost in terms of the religion, Honorable Speaker. And maybe among the amendments, Honorable Speaker, that we are going to be proposing is to tie this to our social security, to tie this into insurance agencies, that insurance companies that provide insurance in this nation, so that, Honorable Speaker, hospitals can have insurance when a loved one is lost, and when when a loved one is lost and the family is unable to raise the funds, they can go to that insurance to claim for something instead of going the civil case way, as Honorable Njeri Maina had proposed. I also want to propose, Honorable Speaker, another amendment that is very important, is to also give a timeline so that it doesn't mean that every single body that has died in hospital, the family negates the payment knowing very well there is law to say release the body immediately. We need to put a timeline, maybe a week or two, for ensuring that there is also some effort from the side of the family to have the body of their loved one getting buried, Honorable Speaker. Honorable Speaker, I can't finish my contribution without saying this House must critically look at the health sector of this nation. And without a doubt, Honorable Speaker, I'll say that yes, we have passed laws here, including the ones that established SHA and SHIF. But we need to agree that our health sector in this nation is ailing. The myriad of challenges, Honorable Speaker, cannot be underscored by this House. We have equipment in our public hospitals that are not working. Many of our hospitals, level 5s and level 4s, are actually hospitals that are not in operation. And it is a deathbed of many of our loved ones, Honorable Speaker. We have seen the program that was started by the former regime, Honorable Speaker, of the equipment. Many of those equipments are not working today. And it means that the deaths that we want today to pass and say that they should not be detaining the bodies, Honorable Speaker, we will have more of those if we don't work and put health first, Honorable Speaker, in this House. Honorable Speaker, Article 43 is very clear on the right of Kenyans when it comes to health care. And one of the purpose of this House is to push and ensure that our Constitution is well obeyed. If it is a county government, we must ensure and call our brothers in the upper house, in the Senate, Honorable Speaker, to ensure and compel health care systems that work in the counties so that, Honorable Speaker, we don't continue facing the challenges that we are facing. Honorable Speaker, we raised some issues here with the Ministry of Health last year. Some of them involved an equipment that was supposed to change the diagnosis and treatment of cancer in this nation. The cyber knife, Honorable Speaker, equipment in the KU hospital, Honorable Speaker. That equipment that was launched in the year 2023, even today has never operated, simply because we don't have a technician to use such an equipment. It speaks to lack of seriousness when we are investing in serious equipment and using public money. I call upon this House to work this year to ensure that we do pass laws and compel our health care to work, Honorable Speaker. SHA is also something that is not very clear. We need to pass laws to ensure SHA works for the people. How comes, Honorable Speaker, me that is paid by government every month, contributes monthly, but when a hustler, a matatu tout, gets to pay SHA, is told to pay for 2 years? It is not right, it is not fair, and Honorable Speaker, those are things that are ailing our nation. As I support this bill, Honorable Speaker, I want to call upon this House to reconsider that law and ensure that it works for the nation. Thank you, Honorable Speaker.
Honorable, I could actually read this for so that you don't carry your hands up. The next person online is Charles Ngusia, will be followed by Gitonga Murugara, like that, so that you don't keep holding your hands. It's that simple. Honorable Ngusia.
Thank you, Mr. Speaker, Honorable Speaker, for this opportunity to contribute to this critical bill, actually, which has been done by Honorable Njeri. Congratulations, the lady from Kirinyaga, who has done a very good bill. Mr. Speaker, this bill is killing two birds with one stone. Number one, it is going to criminalize, or rather illegalize, the retention of dead bodies, and also it is going to ensure we are going to streamline emergency treatment of emergency cases in our hospital, Mr. Speaker. Mr. Speaker, I note with concern that Kenya ratified international treaties that actually compel, or rather forces the state to respect and to protect and, of course, fulfill the right of health as enshrined in our Constitution. And that is why this bill is so important. It is going to align with the international standard and also live into the spirit of our Constitution 2010 we assented. Mr. Speaker,